So good morning. So I'm gonna perform an easy pap. So first is we make sure we check first the patient's chart, contain any relevant information. Then make sure before going inside the patient's room we sanitize or wash our hands. And then once inside, introduce ourselves and explain the therapy such as good morning. My name is Anthony. I'm from the respiratory care department. So the doctor ordered you easy pap. This therapy is a positive partial therapy where it would help you mobilize secretions, relieve any airway secretions inside, clear up your airways, and prevent your lungs from being collapsed. So first is we check the patient's ID band. After checking the patient's ID band, we should always do a set of vital signs, obtain any important vital signs such as auscultation, and then make sure we always wash your hands and apply PPE such as gloves. So once done, we either position the patient if they can sit upright, or we can assist them and or adjust the bed. So ideally, we inspect the device first. If there are any cracks present, make sure there are no misconnections, and make sure the supplies are complete. So first is there are two ports on it. So with these two ports, the first one is we're gonna be hook up with the oxygen tubing, and then the other one is we're gonna hook up also with this pressure monitoring port. When inserting both of these, make sure all of them are secured and tight. And then with this oxygen tubing, ideally we start it up at about 5 liters. We don't give too much high inspiratory flow, such as more than 60 liters per minute. So after that, we set this pressure with the appropriate setting depending on the status of the patient, and then the patient should hold it upright, not in the downward. And then we should also let the patient inform them that they should not occlude in the back. And then with this, we should also have a mouthpiece, which is normally done with this device, where the patient should put inside with their mouth, sealed with their lips, and then tongue should be underneath. Another thing to note is we should also have an option such as a mask in place, just in case the patient could not tolerate the mouthpiece. And then when doing this, make sure we always demonstrate to the patient. First is put inside in the mouth, let the patient take a slow deep inspiration, and let the patient have a strong exhalation. It should not a forceful way, as long as we're able to meet the 1 to 3 or 1 to 4, which is 3 or 4 second exhalation time. After this is you remove it first for the patient, let them rest for a few seconds, and allow them to cough if they are able to. If there are secretions, make sure we have a basin where they can expectorate, or a specimen cup. Observe the color, consistency, and its amount. And then if done, ideally also is we can use this device at about not more than 5 times, so that way we prevent any complications if the patient complains any fatigue or even lightheadedness. And another thing to note is with this, we can also use it together with a nebulization treatment, wherein the purpose of that one is it would help improve their lung function. And once everything is done, this one should be disposed because it's disposable. This one should not be soaked up in water or even soap. Should be air dried only. Put this in a clean safety containers, plastic, together with this tubing. With the mouthpiece, should clear it up with sterile water and should be air dried. After dry, put those in the plastic bag. And then once everything is done, we should always do another set of vital signs, re-auscultate if there are any improvements, reposition the patient. Once outside, remove PPE, wash our hands, chart everything what we observed, especially if how much pressure the patient was able to reach, and if they were able to tolerate it, and make sure we communicate with the staff in charge.